Stars enabled. Oh my, that is a bit wild, isn't it?
I'm just disappointed because it's so vibrant. I think I might
Good
get a blue
afternoon.
one and do mine blue.
Blue.
I want it like ice.
Blue, that was
Like
I love that.
Hello everybody.
Oh,
there is no one there
blue
right this
rinse
second.
brigade.
Oh, if you're not live, go live.
Yeah, go live.
Go live, quick.
what are you on? Are you Facebook?
I'm on Facebook,
You're
but
Insta
nobody
Insta.
joined straight away, so I just wanted to give it a second to try and get anybody watching before you start doing part 2. But you know, Janie's priority.
Yes,
so
she is.
hello.
Repertoire.
So
Where
just-
would we be without our models?
Is true.
We're telling your followers that you've started a live video.
Okay.
Well, go on and tell them then.
If you've done 2 out of 4, have
I've
you?
done up to 2, so I'm just going to do
Yep,
the
go
lowest.
for it. So if you just do 1 and then I'll go in closer for the last one. End dog is here.
Jade's here.
It's
Hold
just
on, we're telling more followers to join your video.
oh, that would be nice, wouldn't it? My arms are sore. I don't know what that Thai massage did. I recommended it on the email, but I'm thinking twice about
Still
it
feeling
now.
drunk today?
Yes,
Waffling.
yeah.
Hi,
Right,
Jane.
so Janie is having a dental block. She's having her lips filled, and a dental block is very, very nice because it means that you will feel next to nothing of the process. It's the same thing that you have when you are having a filling.
Cunning. Dental block.
Dental
And a
block.
dentist.
Dental block.
I wouldn't be without the dental block.
I've never had my lips done without a dental block. I'm too much of a
I
wuss.
wouldn't
So,
want to.
Janie, do you feel a bit weird? Is it kicking in?
Yes.
Yeah.
You realise I'm going
We're
to
gonna
get you
get-
to say Bournemouth at the end of this.
That's it. Eventually it's, we say Bournemouth and Pool, but there's another one.
There is another one, but
we're not going to go there with that one.
explicit.
It begins with an X and sounds like duck. And you won't be able to say that.
So yeah, for anybody that is tuning in or watching this back, you don't need to film me, Nathan.
Okay, sure.
This is a demo of lip fillers, and Janie here is our beautiful model. You haven't. Have you had them done before, Janie? I can't remember. No. Okay. She is a lip
That's the one,
filler
Jane. That's the one.
virgin. What's that?
She knows the word.
Oh.
She
Yeah,
knows
if you've had
the
lips
word.
done here before, you'll know the one that rhymes with duck that we make you say. So Ali's just numbing Janie because we like to make it as comfortable as possible. And I think that's one of the fear factors with lips, isn't it? Is the
A
pain.
lot of people say they're scared of the pain, but really, I would say it's one of the most comfortable.
It is. The dental block is a bit stingy,
It's stingy to start with, but that's like
but
seconds, isn't
it's
it?
worth it. Should we put the camera on us? Oh wait, no, hold on. Let me
That
flip it back.
nothing's changed because when you have a dental block, it can feel like your lips are out here.
Yeah.
And if you're already like, I don't want anyone to know, and
Angela.
you think I've done
Yeah.
with your lips before I've even started, it's just change of sensation.
And you
it's
feel like you're
strange.
dribbling.
You do, and your nose is
Your
running.
nose is running, but it's not.
No,
You
it's
just
not.
feel like it.
You
As you
still
can
look
see-
beautiful.
As you can see, it's definitely not. Now, not everybody's a fan of dental blocks because it changes things up a little bit. I think the arguments against having them.
Do you have to have your mask?
Yes.
Okay. It's so muffled.
The
That's the thing. I'm
arguments
coming
against.
closer.
I think people can hear me loud and clear. Have a go out with a cup of tea. Bob the Builder over here.
Bob,
The arguments against it are that your patient is your first warning system, really. So if they're numb and you run into a problem with your filler, they're not going to feel it and they're not going to alert you.
Mhm.
So it's a valid reason. Other reasons are that obviously Jamie can't use her muscles as she would normally. So it changes how things look a little bit. You've also infiltrated 1/2 mil of sort of dental block into each of these 4 corners, so that can change the lay of the land a little bit. But I just can't see that it's kind to not have one.
Yeah.
Some people don't want it. That's
I was going to
fine.
say
You
some
don't
have
to.
the numbing cream, don't
Yeah,
they?
but
They're
I-
braver than I am.
Me
Just saying.
too. I've had numbing cream over the years, and it's not bad, but it's not.
I don't know, most people
You're
that
not
I've
numb.
spoken to that have had that, it's sort of put them off having it again because it's been
Really?
very painful. But
Maybe it wasn't left on long enough. You know,
maybe they weren't using the filler that has the lidocaine in it because
Yeah.
it was a while back, and that's more of an
anaesthetic.
Yeah.
lidocaine is anaesthetic,
Yeah.
numbing stuff, technical lingo,
Yeah, stop being technical.
numbing shiz.
Ice is really good as well. Over the COVID malarkey, we were using ice, weren't we? Ice and numbing cream.
Oh, did you?
And,
Well, yes, we weren't allowed to be fishing around inside mouths.
and a vibrator. That sounds wrong, doesn't it?
Yep.
A vibrating device. Does that still sound wrong?
Yeah.
Well,
Yeah.
Okay.
Let's get to the good bit. Come on.
Okay. So we've had a discussion about what Janie wants, because I think people think that there's one size fits all with lips, and there's really not. Everybody's lips are different. It's not about what I think, what I want. You know, I can give an expert opinion, but it's about what the patient's wanting to achieve. And that's quite hard sometimes to nail down, isn't it? Like when I ask you, I don't know, what do you think? It's not what I think. So it's about what you're wanting, and she's got beautiful lips already.
She
She
has.
has a lovely shape.
What the patient's wanting to get out of it, what's bothering them. So there's lots of different techniques, and I know you've got those up, or you can show them.
I do,
On your doodle. So Janie's got lovely lips. So around the outside, there's a little
Excuse me, just
a
hiccuped.
little tube. I know you're honestly just keep it the top end and not the bottom.
I'm just keeping it real.
You can see like a little line going around the outside. That's her vermilion border, and it's quite nice to just get into that. It's like a little tube, and put a little bit of filler around the edge of the lips to just give it the definition. She's got a Cupid's bow, but we discussed that we want to just enhance that a little bit, pronounce it a little bit.
It's so pretty.
I know. And there's maybe a little bit, so lip symmetry, it's the eye of the beholder. So in terms of the ideal of beauty within aesthetics, it's meant to be a third, 2/3. But lots of people like 50-50. They want their lips even. We don't do the trouty pouty where the top lip is like massively bigger than the bottom. But I think Janie could just have a little bit into the pink bit of her top lip, just to invert it out a little bit. And then I want to just do a tiny little bit in the bottom just to match it, really.
Okay.
Jane says she has lovely lips, so that's good.
She does. If anybody's watching, by the way, especially you lot on Facebook, please do say hi, ask any questions. I've not had any comments yet, and I'm feeling very lonely.
Oh,
Don't let me down.
They're all over on my Insta.
Yeah, you've got the better audience on Insta.
Yeah, they are better.
Come on.
When you join here, you're better. It's like a competition between me and Jane.
Come on, Facebookers.
Come on.
Right, so Ali's just getting started, so we're just giving her a moment just to
I
to
have
get
got some questions from people. They've done overnight on the
let's
anonymous.
answer some of those whilst we are waiting. So
That's just picking up already. We've just done one to a million border. She didn't flinch.
Didn't flinch.
Look at that, nice little sausage.
a sausage.
A little
Let me get my
sausage.
hand out of the way for you. Oh yes, pre-warning. If you don't like needles, this is not the video for you.
Well, I can't win because nobody liked it when I do cannula either.
Well, I just think it's anything injectable. Some people are weird about.
I know. Don't watch them. Why would they tune in?
Well,
we do.
It might have just popped up.
Just clicked
Mind
on
you,
it.
it's called lip filler demo, so
I mean, yeah.
if you've tuned in, it's on you. Do you want me to hold that this side?
You got it. Yeah.
Yeah, that's better.
Lovely. Lovely.
Am I in the way, Mum?
Are you ambidextrous? Have you got both hands going? Can
I'm
you just
trying.
turn me up a little bit. Turn me on. Thank
Enough?
you. Yeah, that's fine. Thank you.
I can grab it now if you
Got
want.
it?
Yeah.
So, Jade, I'm focused, so if you want to ask things, you're going to have to just ask
I
them.
will do, but I've got my list of questions. But I was about to start, and you called me over for the Cupid's bow. So, here's a question, which I'll ask in a minute when Janie can answer.
Yeah.
Does it hurt? Is what I want
Oh,
to know.
yes, I forgot people had...
Yeah.
Anonymously.
So, no, how are you finding the sensation? Kind of weird? Is it, but not, you're not, it's not sore? No.
Can't feel a thing.
Perfect.
Amazing.
So I'm not
Okay.
fixing non-dental blocks, but you would be more aware, I think, if you didn't have
Yeah.
dental blocks.
So in the spirit of honesty, dental block, no, doesn't particularly, although you can't guarantee that you're completely numb with a dental
No,
block.
you can't.
But it is a lot more comfortable than just numbing cream. With just numbing cream, I would say there's an element of discomfort.
Yeah.
I think most people would agree. And I'm not signing up for that.
No.
So that's the first one. Will I look like a duck is a question, which is, I think that's probably one of the top concerns for people.
It is. I think it really is. I think it's there's a degree of swelling, of course there is, because it's multiple little injections, and and your own tissue is going to go, ah, I've been injured. So you will have a little bit of swelling, like if you've got a bee sting or a cat scratch, you do. That's like the first 2-3 days you have a histamine response. So yes, there's going to be swelling. But when you see these really, where the lips come out the door before the patient does, it's probably one or two things or both things. It's too much filler.
Yeah.
So they've just had more and more and more and more put in, and it's the wrong thickness filler. I don't know if that's gone out, the little video that I did about thickness. So like if we want to fill cheeks,
yes,
a thick filler for cheeks. But lips are soft and squishy, look, they're sensitive, so why would we want to put a really stiff, thick filler into lips?
Okay.
But that's what gives them that whoop bit.
Yeah.
Yeah,
and it might have migrated as well,
Yeah.
which is a hot topic at the moment.
It is, and it can happen. Oh my God, it's a hot topic. Migration can happen. It's more likely to happen if you have larger volumes of filler.
Yeah.
What is it?
It's where the filler moves from the place the injector put it and moves to another area of the face. So,
Like above your top lip, so you end up looking a bit Marge Simpson.
Yeah, like that.
Yeah.
Okay.
It shouldn't, because the lips are compartmentalised, but it can do. Of course it can.
So back to, you can carry on, I'll answer this, but back to the question, will I look like a duck? In short, no, you shouldn't. If you have the right type of filler, the right amount of filler and the right injector, then no, there's no reason that you should look like a duck.
No, I get a lot of people at front desk saying that they don't want to look like a duck, and I always say I've had 3 meals in mine over. I'm gonna
that's a really good. That's a really
Look
good.
at
you
one, really.
It depends on your starting point as well, of course.
Yeah.
Well, I had no top lip.
And Jade's got really full lips. If I put 3 mils in you, you'd look like a duck.
Mine.
I mean, she's born like that.
Maybe she's born with it. Maybe it's 50% Ali and 50% Ali.
Ali.
Yeah, it's all Ali.
It's all Ali.
Birthed you as well, Lady Lou.
Hi Jane. Hi Kathy. Kathy loves it when you talk when someone's got the needle in their lips. They can't actually answer.
It's like a dentist.
Doesn't hurt.
It's like what dentists do.
And that's what they do when you have a meal. Wait till your mouth's full and then ask if you like it.
I know. Yeah, that does bug me.
Oh, that looks lovely.
It does, doesn't it? So we're just, because she's got a beautiful shape, so I just want to pick that up a little bit more.
So yeah, it's just about enhancing what's already there. So how many meals can I have in one sitting?
Ooh.
Short answer, 1. You
definitely
can have more than 1 meal in total, as Nathan's just said. He's had 3 over a period of time. How long would you leave between if someone had a meal and they already knew there and then, even with swelling?
2 weeks, so really. I just
At least 2 weeks.
It probably doesn't need to be that long. People will put more in. So the reason I like to sort of leave it is I'm very cautious, I suppose, in terms of, especially if it's the first time for somebody, not overcooking it, because it's still really hard. We focus a lot on consultation and about what the patient's goals and expectations are and their objectives, what they want to achieve. But still, when your face has changed, don't focus on you, I just shove filler in. But when your face has changed, it is changed, isn't it? And it can take some getting used to. So that's partly it, but it's also, predominantly for safety. Because the lips have got lots of vessels in them, you've got a nice picture.
Oh yeah,
where is it? Is it?
So, and one of the risks, we don't ever hide it from you, the risks that are associated with any of our treatments. So it's not about, come in, you can have your lip filler, I'll shove it in, off you go. It's about your safety, and so we're quite overt with things that can go wrong, and blocking off a little tiny wee blood vessel is one of the things. So you can see lots and lots and lots of blood vessels in there. So if you're putting big fat lots of filler in there is the chance that you could block a vessel off.
It's crazy, isn't it?
Which leads nicely on to what is the downtime, and so many people ask you, can you make sure I don't bruise? Will I bruise? I don't want to bruise. That so and so can't know. When you look at that you've just shown, and all the vessels, all the vessels, there's little teeny tiny ones, and you're putting a needle in that. The likelihood is that you could You could have a bruise. You could have more than one bruise.
There's so many veins in that area.
Do my bestie, but
you do. I mean, it's quite rare that
you don't often, but it is always a possibility that you're warned about beforehand.
Yeah.
So if you're trying to have it done and you don't want, the other half to know or anything like that, we can't guarantee that.
No, definitely not.
Obviously,
never do guarantee it.
There are things you can do to try and minimise it. So Ali will advise you things like stopping multivits ahead of the treatment for, I don't know how long, a few days, a week?
A couple of days either side of treatment.
Couple of days. Don't get drunk as a skunk the night before.
Alcohol's a terror.
Oh, if people have been drinking, Ali will know when she treats you. And you will end up with bruises, so there's no point. There's a few things you could do to help yourself as well. Now, downtime as well, obviously swelling is going to be a factor. I mean, you can see Ali is making entry points with a needle. If you stabbed any bit of skin repeatedly with a needle, it's probably going to swell.
You will bruise and swell.
Swelling can last, probably up to 72 hours maybe. I'd say, 2 to 3 days. Mm-hmm. And I'm talking from really my experience rather than the general rule. Would that be sort of fair to say, Mum?
Yeah, I think the first 3 days it's your normal histamine response, and then for the filler to sort of start settling down and becoming part of you, it's probably another couple of weeks after that.
Yeah.
So
they can feel a bit lumpy bumpy to start with on occasion, can't they?
Yes.
But that is because, as Ali's just said, the filler needs to integrate into your tissues, and that's whether it's lips or other areas. I have my cheeks done regularly, and sometimes I can feel a little nodule here or there for a couple of weeks, and then as you can see now, it's just.
Can I correct you?
What? Yeah, of course. If I'm giving duff information.
You're not feeling a nodule.
Well, not nodules, lumpy bumpy bits.
So the fillers are gel. They're like a sterile gel. So it's a gel implant that you're putting in, and because all the tissues surrounding where you place the filler go, I'm injured. They swell, so they can make the filler a bit constricted, and it can feel a bit asymmetrical, a bit lumpy bumpy, but it's not a nodule. That's different. That's a different one.
See, this is why it's not my area of expertise, because I don't get the lingo right.
Filler lingo.
But it's good. Nodules can happen.
Nodules can, and so I suppose I don't really want to dwell on all the possible negatives, but they're important. So if you get a nodule, that's what you would potentially dissolve if it was problematic.
I had a query last night from a lady whose niece has had her, bless her, she's only 18, and she's had lip filler done, and I mean, it's a shame we can't show it really, but it's just, can you just see that inflating when I do that? It's quite nice,
I love that.
But she's just got
like
a row
magic
of lumps all the way along her lips. They're probably nodules.
And those don't go on there by themselves, really. They need dissolving. Now, lip filler, or actually filler full stop, being dissolved is quite a hot topic at the moment. You'll find a lot of the Love Islanders, the reality so-called stars that have had their faces overfilled are all going, natural,
but they're still
and
having
dissolving.
filler,
But they're talking about it like it's a really simple, straightforward, casual procedure, which, let's turn it back to us for a sec, which,
hello.
Dissolving filler is not something that is just done on a whim because you've changed your mind and you just don't really like it anymore, because it actually comes with quite a lot of risks, on its own, of the main one being anaphylaxis.
Yes.
Never a good one, really,
No.
Yeah, that's fairly significant.
It's definitely not something we take lightly here.
So it is possible. So if you have something that's gone wrong, filler that has blocked something, and that is really important to take that seriously. Yeah. And hyaluronidase is a drug that is used to break down filler, but it can also, as well as come with a risk of anaphylaxis, it can also break down some of your own hyaluronic acid. So it's not temporarily, but it's not something that should be taken lightly and just done on a whim.
Yeah.
So really it's reserved for if you've actually got problems, blockages, nodules, things that are actually risky or just really unsightly, as opposed to I just had my lips done last week and now I don't fancy them anymore.
I want them again.
So that's that. Let me turn back round.
While you're on that,
yes.
I'm so anti-fuzz because I'm an old goat really, but fads.
fads.
The fad of let's dissolve it and refill it at the same time.
Which is big at the moment. TikTok
Your
trend.
mask is so wonky, Mum. She hasn't been drinking, I promise. There you go. Kinda.
Is it my mask or my ears are on wonky?
It's not on your ears, so your whole head in that case.
You're just wonky.
Which way do I need to go?
The other way.
Oh.
There we go.
Okay.
Perfect.
So... I've got it. Let me just pop this down. So, what am I talking about? Filler dissolving. Yeah.
Were you going to say about the...
Well, and that. 2 fads, but the dissolving and refilling at the same time. Why? So when you use the solution to dissolve, it carries on working for some time, and you can lose some of your own natural hyaluronic acid as well for a couple of days. You replenish it, but you can lose some of it. It can cause swelling, it can cause bruising. So why would you put a dissolving agent in and then put new filler in at the same time? I just think it's increased risk for your patient, it's increased discomfort. And how are you going to judge the outcome of that, really? You can't...
Just to clarify, this is a new trend where people are dissolving and refilling in the same sitting.
It's a big TikTok thing at the moment.
It's not advisable.
It's huge. I also think as well, I'm not a happy dissolver unless there is an issue, because I just think it shows that a lack of communication between me and the patient, that we haven't sat and really discussed what they want, what their outcomes, their goals are, and made a treatment plan that's appropriate for them. So I should be fulfilling the patient's needs, if you like, not always their wants, because what they want might not be achievable. We should have had that discussion, come to that agreement. I know what they're after. I've said yes or no that I can achieve it. So we shouldn't even get to that point.
Yeah.
And the other one on the dissolving is the lip taping.
Yeah.
Katie Price.
Have you seen that? Oh my God!
I can't Google it annoyingly.
I could try it on there.
Micropore tape everywhere. Oh, you haven't seen it?
No, I'm going to try and get it. For anyone that hasn't seen it, Safari's probably.
Yeah.
We're not far off. I'm dragging it out a bit because of them two waffling.
She means educating the public.
Well, of course, if I was a certain doctor, I could bang them out in 7 minutes. Names shall remain unnamed.
Yeah. I don't even know who that is.
You don't want to know.
7 minutes. Oh, is that the lip taping one?
Yeah.
No, we're not saying.
Yeah, but that could be anything.
Actually,
she might not be the only.
Say because she's quite proud of it.
She's proud of
it.
She is out and proud.
But lip filler.
How do I make the page bigger now?
Lip filler dissolve.
Yeah, but how do I make this stupid bit go away? No, the whole chunk of the page. That's it. There you go. There she is.
Right. So can you see she's got tape all around her lips?
I mean, they just...
It's awful. But this is the new TikTok trend, and it's just...
So she's had fillers dissolved, old filler dissolved, and then tape slathered all over her. And then more put back in.
The theory is that you will stop the filler from migrating anywhere. I mean, what a load of old chaff, isn't it? It really is. It really is.
Yeah, it's meant to stop the migration once you've put the
new filler.
Yeah, the new filler in once you've already dissolved the old filler.
Even though the old filler is being dissolved for the next 48 hours or so.
I mean, maybe in time there'll be some significant research and papers to support that and show that it does work, but there's not at the moment. So as far as I know,
how are you doing, Janie Jane?
All good. Well done.
I know, it's weird, isn't it? Right, so let's come in a little bit closer. You're coming that side. I'm coming in this side in that case. I'm coming this side. So, does it hurt? We've gone through. How long does lip filler last?
Oh, that's good.
If you want to keep treating Janie, I'm quite happy to answer some of these.
Okay, yeah, you know that, don't you?
So, with lip filler, because, as Ali said in the video we posted recently, it is generally one of the softer types of filler that she will choose to use. You're looking at about 9 to 12 months. Obviously, there's going to be different factors that will impact that lifestyle, and just your own body's way of breaking down that filler. Some people's faces do like to eat filler versus other people.
You're one.
Yeah,
I am one.
This one.
My face does love to just get through it.
Shocking.
I No, but on average, you're looking at about 9 to 12 months. And even at the 12-month stage, the filler won't be completely gone. And it would be unusual to be completely back to square one, wouldn't it?
Well, so we wheel these things out about timings or whatever. It's massively generic because they have on cadaver dissections or whatever found filler 3, 4, 5 years down the line. I know it is. So it can be there. It can be there longer. And of course, the fact that I'm causing injuries as I go is Jane's going to make her some of her own collagen, isn't she? So
yeah,
to repair.
So even, I mean, I only have sort of a tiny amount at a time when I have mine, about 0.5 ml, I think.
In your lips?
Yeah. And when I feel that that's gone, I always look back at my original pictures and my lips have never gone back to the starting point. Even though they were full to start with, they're a much nicer, more symmetrical shape now.
See,
cheers, Mum.
Oh, am I right in front of it?
No, for that.
Oh, you're welcome. So basically what she's saying is that I buggered it up first time when I made her in my womb.
I mean, you could have made me a bit more symmetrical.
Well, I've not had my lips done for
about
a year, I reckon. If not a bit longer. And
really? Yeah, maybe.
I still have a top lip now and I never had one before.
I know. I think my favourite example is SP. I love his lips where it shows over the years.
Progression.
That was 3 mils, wasn't it?
It was, yeah.
Because we were having a competition, I think.
Lip off.
I know, but I think that shows you. I don't know if. I mean, we haven't got permission, have we, to show? So
no.
So we won't do that.
I don't know.
It shows you.
Did.
It shows you how you can build volume and still not look like a duck.
Yeah.
Quick.
It's on our Insta.
So while I'm looking for that quickly. Oh, it's on Insta, not on here. Is it not?
No, on the OneDrive you'll find it.
I thought it was. Oh, I'm filming your glove. Sorry.
Oh, that's nice.
It's hard to look for something.
It really is.
Oh, this is on OneDrive. That's throwing me. How do I get rid of that?
Oh, that's quite good to show them that actually while you're on it.
Okay,
all the different techniques there.
Oh,
so
that's
very
one
size fits all. You can zoom it and go along. Russian, that's something that people ask about a lot. That's another little faddy fad.
If you tilt it up, there we go, because the light's on it. So there are lots of different approaches, technique-wise, to actually doing lips. And I'm just scanning through some of the many now. Hold on.
Because really, this won't mean much to most of you, but these are different
Russian,
techniques that Ali
restoration. Oh, Botox, that's not for in the lips, so we won't go there. And some of them come with a higher risk than others.
That is for in the lip, darling.
What, Botox?
The lip flip and all this.
Oh, I know, but we've only got so many hours in the day.
Yeah, but it just gives people an idea when they come and ask for a miller lip filler. Thank you,
there's
Dr. Tim. For
bazillion different ways to skin the proverbial.
Don't say that to cat lovers.
Cat lovers. Where is it? There.
Oh, yeah. I love this.
So this is a perfect example.
Look at that.
Oh, I can't get it all in. Of progression over.
I know, it's lovely.
A number of. Oh, there we go.
Number of treatments.
Yeah, that's great.
Doop, doop, doop. Oh, they're so pretty, aren't they?
That's very much like how my top lip was.
But they still look really natural.
Yeah, they do look really natural, and that also, is a good point to say that this is not just for women. Men can have lip filler because male or female, as we age, our lips get thinner, they lose colour, they lose hydration, and it is one of the little parts of the ageing process that is subtle, but does happen to all of us. So men can have this done without them looking filled.
Yeah.
Most men, if you said lip filler, they go, oh no, no,
that's fair.
Can't have that. But actually, you can. And then I think the last question on there, I'm sure not the last, if anyone has questions when they watch this back, please do ask, because I must admit the engagement on Facebook has been fairly tragic.
Oh, I've been pretty good over my Insta lot.
I have had 2 comments and 2 viewers through most of it. I know you can't win, can you? What was it? Where was it? Will I see results straight away? Well,
as you can see.
Well,
now she's making her look like Father Christmas. But
you would have seen results 10 seconds ago.
Oh, stop. Let me just. There you are. There you are.
So the short answer is yes. Obviously, I mean they look so pretty.
That you could see. But
They look lovely.
They look lovely.
They do well. Perfect for me to work with, to be fair.
Good.
Because they were just lovely to start off
They are
with.
beautiful. And so, yes, you will see an immediate difference. Sometimes it's not always the difference you want to see because there'll be quite a bit of swelling for some people.
Yeah, that's quite key. I think people think because fill is instantaneous, it's fill and go. But, you know, don't if you're going off to, if you've got an event planned straight after my needle. I always think that when you see these befores and afters, they're a bit cheaty. I don't know when they take them because they're not fresh off the needle. Because quite often they do look a bit ropey.
Yeah.
I think they are fresh off the needle, but a lot of them are edited or they've got this
I know.
pink balm slathered all over them, which...
Yeah, I don't
just-
like putting anything on. It occludes where you've been. I just like a bit of arnica. That's it.
So, yay! Thank you, Selena. We have a question.
Oh.
So, do you have to massage the lips afterwards to prevent lumps?
No, as you can see, I'm just doing that now to feel where things are. You shouldn't get lumps. The only lump that you may get is something called a nodule. So it's for me to just feel that everything's smooth when Janie leaves, because it might feel lumpy to her, as we said earlier, because her own tissues will swell. But you shouldn't need to be doing it. If you do get a nodule on your phone and you're concerned and you can't get in, then I might say, yeah, by all means, have a little roll and a massage of it yourself, but I'll still want to review.
So, a general rule, no.
No.
Leave them alone.
Exactly
Let nature do
that.
its thing, and then Ali will review if needs be.
Exactly that.
Thank you so much for your question, Selena. I was very excited by that.
Janie.
We've got a question! Got a question. Yeah, well done, Janie. You've
Yeah,
been
well done.
fantastic.
She's still smiling, you see, so it's not that bad.
And they can't see the knife that I'm holding to you. How did you find that process?
Let me just see.
Easy peasy.
Easy peasy.
Easy peasy. Lemon squeeze.
Say Bournemouth.
Bournemouth.
Oh, she can say it well! Damn
actually-
it! It's because it took so long that it's worn off.
I don't know. You've got it on yours, haven't you? I don't know if that will
What?
show a decent. I'm gonna
Oh, resume.
See,
Jade
this is
Graham.
why you should come over to Instagram.
I was
You're a
trying to
bit
find
more
a picture.
professional, okay,
I'm gonna
guys?
cheat. Yeah,
That's
it.
not. Oh, okay.
That's not-
I mean, you can't. It's too tiny.
Well, I can't go any bigger, really. It doesn't go any bigger on that. It doesn't.
We'll
you're phoning,
post
you'll
them
cut
after.
people
Yeah,
off.
we'll post
You'll
them.
cut people off.
Janie's before, but lips aren't together either. So I will post a nice before and after so you can see. But you can see a
Lovely
little
though.
bit.
But they're on her phone, and she'll.
They
cut them
are, and
off
I
if
nearly
she does
just
that.
ended
So I
the
just
live.
thought,
They're
I've
so
done that
pretty.
They are very pretty.
Just to mark up. That's what's
Okay.
going on. You, the
Right.
important person in the room. You haven't paid us, so that
Kimberly says her lips look beautiful.
They
Oh,
do. They
you know I
do.
did before I did anything, so it's just a little
just
enhancement.
enhancement.
You're a darling. You really
That's
are.
the aim of the game. Right, I hope that's been helpful for everybody. I feel like we've probably missed a load of questions, but we've answered loads too. So
Yeah. But if you have
If-
any, just comment and
Yeah.
we'll get back to you.
Come in later.
exactly. Right, well done, Janie. You
Yeah,
were
well
a star.
done. Woo!
Thank you, by the way, as well to all of our where is it? Wow, this is wild.
Never
To
mind
all of our
yourself.
Plan Bers who
Yes,
volunteered,
thank
we are
you.
gonna make sure that we have backup
People
models.
still want to see blooming lips.
Yeah, I
all
know.
the time.
Yeah.
And then if you can also put in the comments what you want to see next time, that would be really helpful
Did I
as
make everybody
well.
feel sick doing cheeks or with cannula? Is that what it was?
Well,
Don't know, but I was doing the last few. Bloody hell.
yeah, you are.
And I think it's probably my turn again next.
It's always
So-
my favourite when you do cannula though, because this one, she
Jane
goes,
Daly
she
passes
goes
out.
grey.
I hate it,
I,
Jane.
I had to hold her up last time.
If at any point you see the ceiling being filmed,
Yeah.
that's just because I've
She's not enjoying the moment.
I think we should have a bit of hand rejuvenation or something. That's lovely.
Oh, that's disgusting.
I watched one the other day. It
I
was
was
really good.
saying that because it's
It's-
Having
Yeah,
that.
you did watch me do one, didn't you? Yeah, that's
Oh,
true.
you can film both bits for that one. Ugh. But it's
Right.
actually not, from what I've heard, it's not painful. It's just
No,
yuck,
they were very comfortable
cannulas.
doing it.
Yeah. Right, okay, we're going to love and leave you all.
Yes, thank you for
Oh,
joining
Selena
in.
says you can really see the difference. So I'll take some afters in a second. I'll put them on
Yeah,
the in
definitely.
the thread or
In
whatever
the-
you call it.
on the-
I'll post them somewhere.
Yeah.
Okay.
All right.
Love you all.
Love you, thanks.
Bye.